and I think this is really true, health is our natural state. It's normal to be healthy. Is that true in our culture? No, it's not. You know, so our job as physicians is not to push a patient into a state of health, but to remove the barriers to a patient being healthy. And you know, I was talking to one of my patients today about. Sometimes I watch these YouTube videos on indigenous people and how they, you know, just how they live, and you know, and you don't see any indigenous people that are fat. You know, that these hunter-gatherers eat this wide variety of food they have to catch. They're all really muscular and healthy. Now they have to deal with other things like, you know, venomous snakes and things like that. And if they want honey, they have to face killer bees. But they're all healthy, and they all, you know, they don't have cancer and heart disease and things like that. And so they're in a really natural state. Now, I don't know that I could live like they do, you know, but I think that there's a lot to be said by some of the things that they do. So today, we're going to talk about what I consider the main thing in our body that creates health, and that's our nervous system. And if you know, we call this the safety pin cycle, and it's because it looks like one. If this is the brain and this is the body, this is our nervous system that connects our brain to our body. And a subluxation, okay, sorry about that.
That's fair.
Okay. So a subluxation unhooks a little bit of our brain from our body. And so all primary care doctors who care for people with the primary intention to enhance and express health and life understand this system here. Now, if you look at how the body works, and this law that I'm talking about between the brain and the body and the brain, this isn't a chiropractic thing or a chiropractic philosophy. It's a scientific fact of physiology that you have the body sends messages to the brain, letting it know what it's experiencing. The brain sends messages back to the body, telling the body how to adapt. And these are loops of communication. So here's how you remember them, okay? It's the way I remember them. The efferent pathway is the brain to the body. So you think of effervescent bubbles bubbling off the brain into the body, okay? So that's the efferent pathway. That's how I remember that. And then the afferent pathway is the body to the brain. So anyone that doesn't know this or respect and understand this law before administering a diagnosis is violating one of the fundamental laws of life. And I'll show you how that works here, or why that works in just a minute. So this pathway is absolutely essential for health, understanding this and keeping this pathway clear. So how important is the nerve supply from the brain to the body? Okay, let's look at the scenarios. Bad scenario number one, you know, somebody's experiencing the guillotine. When the head is severed from the body, what happens? The individual dies that fast. Okay. So why is that? Why does a person die instantaneously? Does a person die instantaneously when they go for 3 or 4 meals without food?
No.
How about when they hold their breath for 30 seconds?
No.
How about when they don't drink water for a day?
No.
No, but they die instantaneously when their head is cut off, because we can't go for 1 second without messages from the brain to the body, not for 1 second. So if we look at our vital needs, and I do a whole talk on this, the vital need, the number one vital need that we have is electricity produced by our brain that tells our body what to do. And if that is severed, we die instantly. Okay? So let's look at bad scenario number 2. a partial severing of the nerve from the brain to the body, a severing of the spinal cord below the atlas. That's what happened to Christopher Reeve, okay? So he went head planted, while he was riding his horse, and severed his cervical nerve up here, and I think he had some use of his hands, but that's it. And so that's a partial severing of the nerve supply. If we look at bad scenario number 3, we have a partial interference from the brain to the body, or the body to the brain, what we call a subluxation, okay? A minor subluxation can cut off 60% of the nerve flow to an organ or a muscle. So what do we call a minor subluxation? A subluxation, nerve pressure, the weight of a dime. So you put a dime on your hand, just hold it there. That much interference to a nerve can cut off the nerve flow by 60%. Now, the guy who discovered that was a Chinese researcher at the University of Colorado who is he's the only person doing this kind of research when I was in chiropractic college. His name was Chung Ha Su. And he came and spoke at our school back in the 70s, the late 70s, when I was in chiropractic college. And he would get, standing ovations. Yay, someone out there is doing chiropractic research. But he found that it took very little interference, very little pressure on a nerve to cause interference. Okay, so this is what chiropractors are trained to do. They're trained to restore the information from the brain to the body and the body to the brain. Now, a subluxation that causes pain, if you just leave it there and leave that misalignment, that's eventually going to destroy that part of your spine. And here you see a lot of degeneration, which we call, the technical term for that is discogenic spondylosis right here. The disc is degenerating, you're starting to get an arthritic spine. That produces nerve interference, which causes problems, okay? Now, let's talk about the central nervous system, because this is the key, really, to everything I do here. The brain is constantly making endless observations and adaptations to keep you healthy. It's doing everything it can to keep your life going. There's no evidence that a healthy brain can create sickness in the body. Even if you never exercise and you never ever eat any healthy food, the only thing you ever eat is junk food, and you sit around and do nothing, your body will do everything it can to keep itself alive. Now, those things that it does may not be very comfortable for you, okay, if you're not exercising and you're eating junk food, but it will do everything it can to adapt to give you another breath. And there's a couple of interesting stories about that. One was this girl, this teenage girl she's 16 years old, and she just collapsed. She was in Great Britain. Just collapsed one day. And they took her to the hospital, and they couldn't find out anything wrong with her. And so they talked to her mother, and her mother says, yeah, I don't know if this is important, but she's never eaten anything but chicken McNuggets since she was 2. So her body did everything it could with those chicken McNuggets to keep her alive, and finally, she survived, but her body finally collapsed. It couldn't do it anymore. There's another story, but very famous investment banker, I can't remember his name right now, I used to know him, very wealthy. The only thing he'd ever eat is he'd eat a shrimp cocktail for lunch and a steak for dinner. Shrimp cocktail for lunch, steak for dinner. He did that for years, and one day his body just gave out, because you can't live off of that. You need more variety in your diet than just a shrimp cocktail and a steak every day. So that's an example of the body trying to adapt to keep you alive. Now, recent published research has conclusively demonstrated that loss of curve in the neck diminishes the neurological communication from the brain to the body and the body to the brain. This is came out in a journal called Scientific Reports in July 2021. I have it back in my office, and this is like the holy grail study of chiropractic, because what this study showed was that when you don't have a proper curve in your neck, you don't have the right messages from the brain to the body. And when you put a proper curve in somebody's neck, it completely changes the messages from the brain to the body. Now, in this study, I'm going to tell you, it's a very interesting study because he had two groups of people. And in the one group, the only thing he did was give them a Denerol, one of those things to lay on, for 3 days a week for 20 minutes. That was the treatment group. That's all he did. 3 days a week for 20 minutes. He did that for 3 months. And then they did EEG studies during that time. The other group didn't do anything, okay? And what they found is the people, he didn't even adjust them. This is a chiropractor that does. The people that laid on the Denerol and restored the curve in their neck had much better brain-to-body electrophysiological communication, okay? And it was Scientific Reports is a very hard journal to get into. It's a very big study. So most people will never hear of this study. I mean, you won't hear this on the pharmaceutical commercials, I guarantee you that. This is a big deal. Here's another one. Same is true with blood supply to the brain. It's a chiropractor that did this study. In fact, when I was doing my radio show, I interviewed him on my show. And so what he did was he looked at necks that didn't have a normal curve in it, reverse curve, not normal curve. And he put them on a Denerol, and then he measured the blood supply, the blood flow to the brain. And he found out that people that had a normal curve in their neck, when you put a normal curve in somebody's neck, that increased blood supply to the brain. Mm-hmm. So do you think the brain works better with more blood supply or less blood supply? More, yeah. Too less is a stroke, right? So yeah, it works with more blood supply. So this is a normal curve. This would be a reverse curve. And this is, you have an artery that runs here. So when this artery is stretched, okay, you don't have blood supply. So getting the right curve in gives the right blood supply to the brain. So the problem is that when you have an abnormal curve in your neck, the problem actually may be coming more from here than here, okay? Now, and when we fix this, we're actually correcting this so the body can heal. So really, we're really not back doctors, we're brain doctors. And I hope to get the equipment in here eventually to show that, to prove that.
So you're talking like headaches and so forth? That's what you're talking about when you say pain in the brain?
Well, what I'm saying is that when you fix the spine, you're actually fixing communication to the brain.
Communication, okay.
Yeah. And actually changing brain function so the body can heal. Yeah. So that would include headaches, include anything, really. And so what we're finding is that, and there's some really good research on that. I don't have all the papers in front of me right now. Is that when you can fix the brain, you can fix many, many, many health issues by getting this right, okay? I know a guy in Denver, a chiropractor in Denver I talked to for a long time in September who's doing just that. So, the central nervous system is pretty amazing. So the body starts out with just two cells, sperm and egg. They divide exponentially. The first thing that's formed is the brain and the spinal cord. Very first thing when a human, brain, spinal cord, first thing, okay? Off of that, grow all the organs, grow off of the brain and the spinal cord. So the nervous system is formed first. The organs grow off the nerves. So that shows you the importance of that system, okay? So the body tries to protect itself appropriately. So we got vital organs protected by the ribs. Do you think it's a coincidence that the brain and the spinal cord are completely encased in bone? No coincidence, okay? Do you think this is a fluke of evolution? Okay, I could talk for a long time and why I don't believe in evolution, just based on science, you know? And so, brain and spinal cord are protected by bone. By weight, bone is 9 times stronger than steel. So subluxations have been described in a lot of different ways. Dysfunctional movement of a joint irritating a nerve, inflammatory process of ligaments and discs and other tissue surrounding the nerve, outright compression of a disc, which you can see sometimes in an MRI, or just electromagnetic changes from inflammation around the tissue. Well, I think probably all of these apply, when you're talking about a subluxation. But I would say anything that alters the electricity from the body to the brain would be considered a subluxation. I don't care what it is. Anything that would alter that and change brain function. So the scientific evidence proves that when people get adjusted, it reveals a response that enhances function and decreases problems. So let's look at 3 ways to look at chiropractic. How many of you have heard this? I don't believe in chiropractic. I mean, golly, back in the 70s, especially when I first went to chiropractic school, man, you talk about hostility. I don't believe in chiropractic. I don't believe in it. Why? Well, I just don't, How about chiropractic is good for pain relief only? Mm-hmm. Yeah. Now, that's mostly why people go to a chiropractic clinic. They're in pain. Okay, I get that, But here's the thing. If you want to go to the 3rd phase, it's chiropractic enhances the way my entire body works, and thus the expression of life and organ function. Now, does everybody get all of their function back when they see a chiropractor automatically? No. Why is that? Why?
Well, it's taken years to get to the point you're at, so it's going to take a while to come back from it.
Yeah, that would be one reason. Any other reason?
Damage beyond repair.
Yeah, good. Yeah, sometimes you just got too much tissue damage, and you can only restore so much function. Okay? So that's right. My view is that, there's people, I see people that have a lot of tissue damage, but why not get your body working as good as it can work? Right. So you can enjoy your life a little bit better. There's certain things that, you cannot fix. Like somebody comes in with phase 3 disc degeneration. I can't unboil a hard-boiled egg. You can't bring that back to normal. But you can slow down that process. You can slow it way down so it's not degenerating nearly as fast. So chiropractic is not necessarily designed to make you instantaneously feel better. Sometimes that happens. When it does, I like it. Patient loves it, It's not, but it's designed to make you instantaneously heal better. So if you study the loop between the brain and the body, do you think that these messages need to travel 100%? Mm-hmm. Yeah. Okay. So do you think a liver trying to detoxify the body needs 100% information from the brain? Mm-hmm. Yeah. Probably. I would say it does. Does a heart require 100% nerve flow without interference from a subluxation to work properly? Yeah, of course it does. So Keith Wasung, he's the one who did the my chiropractic slides up there, stated that thinking of chiropractors as only as pain relief, it's like robbing a bank and stealing only the pens. Okay, so chiropractic's a lot more than pain relief. And what I have found is that people that are under chiropractic care long enough see changes in their bodies that they wouldn't normally feel if they just left after the pain got better. Okay, so let's look at a medical approach to pain. So a lot of times in medicine, you know, if there's enough pain and enough swelling, they'll shoot cortisone in the spine or cortisone in the joint. Now, does that help sometimes? Sometimes people get relief, but what cortisone does is it falsely reduces the swelling and the pain so that you no longer know you have a problem. So what do you do when you feel good? You go out and do stuff, you know, and if you're covering up the pain with cortisone, you may actually injure yourself worse. Yep. Okay, because your body now, you're not aware of what's going on in your body. Okay, so this is more crisis intervention than it is healthcare. That is not healthcare, it's crisis care, symptom care. Now here's an interesting study in a journal, the journal Radiology. And here's what it said in 2019 about steroid injections. Steroid injections cause accelerated osteoarthritis progression. Subchondral insufficiency fracture, okay? Complications of osteonecrosis. Osteonecrosis is when the bone just starts dying, okay? And rapid joint destruction with bone loss. These are some of the complications that can happen with steroid injections. So I'm not saying you should never have one. I'm not saying that. I'm saying that there's problems with them. There can be real problems. And this is in the medical literature. So sometimes the process of getting adjusted is slower than a cortisone shot, but way more in tune with your body's need to feel safe. So do you think there's a reason for pain in your body?
Yeah. Mm-hmm.
Yeah. And what is that reason?
To alert you there's a problem.
Yeah. It's like the oil light in your car. Oil light in your car goes off, you know there's a problem. You know. Now, when I was a teenager, this happened to me when I was out in the middle of nowhere, and I didn't stop, and pretty soon I hear this little ticking sound, and pretty soon, boom, the engine blew up. And that was a bad experience, and I messed up the family car, and I was out in the middle of nowhere, but I'll never do it again. I learned about putting oil in the car, changing the oil, and not a good day for the Firnhaber family. You know, not a good day for a teenager, I can tell you that. But covering up symptoms is like punching out the oil light when the oil light goes on, okay? It doesn't make any sense. So we don't want to hide our symptoms and pretend the afferent pathway is okay. So, you know, we talked about 60% of the nerve, a minor subluxation can shut that down. Only 10% of your nerves deal with pain. The remainder support function. What does that mean for your body? What does that mean for health?
Pain is the last cue to your body that there's a problem.
It may be the last thing your body tells you. And what does that mean? You can have a tremendous loss of function and have no pain. So let me give you an example of this happened to a friend of mine this 2 weekends ago. So this guy, he was lifting a couch, just moving a couch, done it before. They moved the couch from one room to another or something. puts the couch down, sits down on the couch. He falls asleep and he turns blue and has a heart attack. No symptoms up until then. No symptoms. They gave him a 1% chance to live, and they flew him here to Lincoln, and with a lot of prayer, the guy recovered. It was prayer. I mean, I'm not saying the doctors didn't help, but a lot of people prayed. They gave him a 1% chance, and now he's recovered. Okay, this happened 2 weeks ago. The guy had no symptoms before that happened. Okay, symptoms aren't always, he had a loss of function. He had a lot of issues going on, but he didn't even know it until he lifted and moved the couch. And what I'm saying is this, is that if we wait till we have symptoms, we may go through a lot of pain and a lot of problems and a lot of expense. It's much better to take care of yourself than wait till you have symptoms. But on our healthcare system here, which I put healthcare in quotes, it's more symptom care. We got a symptom, we go to the doctor, he gives us a pill. We don't have a lot of interaction with them. We go home, we take the pill, we're supposed to feel better. That's not health care, that's symptom care. So an individual that has a nervous system free of interference can fight off infections and sickness much easier. Why is this? Why is this true? Where's our immune system in our body?
Our gut.
It's in our GI tract, primarily our small and large intestine. 80% of our immune system is in our small and large intestine. Does our small and large intestine have a nerve supply?
Mm-hmm.
Yeah.
Mm-hmm. Yeah.
Where does the nerve supply come out of?
The spine.
The spine, right.
Up to the brain.
So getting adjusted turns that on. Okay, it actually activates that. Now, if the nerve supply, if most of our immune system is in our gut, what does that say about how eating affects the immune system? Might mean like the food we eat has a big effect on our gut and our ability to fight off disease. Okay. So, let's look at kids, for example. Kids that get subluxated may not feel any pain. They don't necessarily have the ability to say, hey, my neck hurts, my back hurts. They may not have any pain at all, but what they might experience is chronic colds, allergies, food intolerances, behavioral issues, ear infections, sore throats, all which stem from interference in the brain to the body. I've seen all of that in kids. And I have a talk on just children in chiropractic where I can show you that studies have been done that kids that are adjusted are a lot healthier than kids that aren't. So there's an article back in 2014 in a prominent neurobiology journal. And it stated that it said the following regarding nerves from the upper neck area. It says they have a great influence on the heart and the lungs, cardiovascular, respiratory area. Stimulation of these areas can influence cardiovascular, respiratory areas. It also influences the entire autonomic nervous system just from the upper part of the neck. So that's why it's difficult to understand how chiropractic can work, because people think, you move a bone, people feel better, they may not have any more pain, but what does that have to do with the rest of the body? See, it's hard for people to understand that. So that's why, and people say, well, once you start going to a chiropractor, you have to go for the rest of your life. You don't have to. I mean, I don't have a chains on the door holding you in here. But it's like brushing your teeth. Do you think keeping your teeth healthy is a good thing? Mm-hmm. Yeah. I mean, I still have all my teeth. I intend when I die, I have all my teeth. Okay. I don't want false teeth, so I'm going to keep them healthy. Do you think, so I'm not going to stop brushing like when I turn 70. That's it. No more brushing my teeth, No, I'm not going to do that. Well, see, it's the same way with our spine. You know, is it good to keep your spine and nervous system healthy, just like your teeth, your whole life? I think it is. Yeah. And, you know, I'm not going to brush my teeth only when they hurt. Well, I'm going to go to the dentist, you know, I have a toothache. I think I'll go to the dentist when I have a toothache. That's ridiculous. I mean, there's some people that operate like that. I don't think it's a good way to do it. So we don't brush our teeth only when they hurt. So if we look at Tour de France riders, a lot of those riders get adjusted every day after they have chiropractors on their team. Racehorses get adjusted because not because they have migraine headaches or PMS. It's because they run better. You know, animals are much healthier and they live longer when they're adjusted. So we don't just adjust people to get them out of pain. We adjust them because it's the right thing to do. We take supplements because it's the right thing to do for our body. So my goal is not just to get you out of pain, it's to help teach you to take better care of yourself. It's to teach you the brain and body requires this 100% afferent pathway. And again, this is not somebody's theory. It's overwhelming. So that is the effect of the nervous system on health. Now, how many of you here believe that the nervous system now is maybe a little bit more important than we thought it might be in terms of our health? Absolutely it is. And so now you can tell other people that you know what you learned tonight, because a lot of people don't know this. Health does not come from a pill, from a drug. How many of you know people that are healthy because they take pharmaceuticals? They'll help with symptoms, but they don't make you healthy. Okay? So, any questions about anything I've gone over tonight? So if, you know, on the 15th or the 16th of November, we're having our Patient Appreciation Day. We're going to be doing complimentary this whole week, subluxation checks, just checking out people's nervous system. You know, this will be a time where you know, some of your unhealthy friends and family can come in. They get a check at our expense. It takes about 15 minutes. And we'll tell them, look, this is what we think is going on. You know, if you want to get, you know, try and get healthy, we can help you with that. You know, if we can't help them, we'll send them somewhere else that can. Maybe it can help them. But at least it's a chance for them to get checked. So they can make an appointment. We have 8 slots open that week. Be glad to look at them. Any questions on that? Okay, good. Thank you for coming tonight. God bless you. And hope that you learned something about your nervous system.
Yeah.
Good.